Right now, something is happening inside your body and you can't feel it. No pain, no warning, just silence. This is hypertension, one of the most invisible conditions on the planet. Think of your blood vessels as rivers, and your heart as the force that keeps those rivers moving. Every single beat, your heart pushes blood outward through every vessel and every corner of your body. That push creates pressure against the walls of your vessels. Normally, that pressure sits around 120/80. The river flows, the walls hold, and everything is in balance. But sometimes, the pressure starts to rise and doesn't come back down. That is when the war begins. Imagine pressing your palm against a wall and never letting go, hour after hour, day after day. Eventually, that wall starts to change. This constant force makes your vessel walls harder, thicker, and less flexible. As the walls thicken, the space inside gets smaller, leaving less room for the blood to move. So, the heart pushes harder, and the pressure rises even more, creating a cycle that feeds itself. This pressure doesn't stay in one place. It travels to the brain, putting delicate vessels under constant stress, to the kidneys, where microscopic filters begin to wear down, and even to the eyes. Through all of this, you feel nothing at all. That is the cruelty of the silent killer. It asks for no attention until one day it can no longer be ignored. But the body is remarkably willing to heal. Movement helps the heart work with less effort, and eating less salt reduces the fluid pushing against those walls. Calm is not a luxury, it is medicine. Your body is extraordinary, working every second to keep you here. Take care of it, not out of fear, but out of gratitude. Have you ever wondered why a migraine feels so different from a normal headache? And why it can completely shut down your day? A migraine is not just a headache. It is a neurological condition involving the brain and the nerves around it. Under normal conditions, the brain processes signals smoothly. But in people prone to migraines, the nervous system is more sensitive. Certain triggers, lack of sleep, stress, bright light, hormonal changes, specific foods can activate this sensitive system. Before the pain even begins, subtle changes may occur inside the brain. In some people, there is something called an aura, flashes of light. This happens because of a wave of electrical activity that spreads across the brain's surface. Then comes the pain phase. During a migraine, the trigeminal nerve, one of the major pain pathways in the head, becomes activated. This leads it to the release of inflammatory chemicals around blood vessels in the brain. The blood vessels become more sensitive. The surrounding nerves send stronger pain signals. That is why migraine pain is often throbbing, usually on one side, and worsens with movement. But migraine is not just pain. It can cause nausea, vomiting, sensitivity to light, sound, and even smells. So, how do we prevent migraines? First, identify your triggers. Maintain consistent sleep. Stay hydrated. Manage stress. Avoid skipping meals. A migraine is not a sign of weakness. It is a sign of a sensitive nervous system. Understanding it is the first step toward controlling it. Protect your brain the way you protect your heart with awareness, routine, and care.